Welcome to the Naturally Healthy Pets Podcast. Let's get to it.
Welcome to the Naturally Healthy Pets Podcast. I'm your host, Dr. Judy Morgan. Today, I think we are going to have a lot of fun because our topic is the future is feline. So all you cat people, listen up because this one is just for you. My guest today is Dr. Angie Krause, and she is a holistic small animal veterinarian who does house calls in Boulder, Colorado. Yay, lucky people of Boulder, Colorado. She believes that cats are underserved, which is very true, and deserve more from veterinary medicine and society. I couldn't agree more. That's why she has created Natural Cat Vet, a community just for cats and the people that love them. Dr. Krause, thank you so much for agreeing to be on the show today.
Oh, you're so welcome. I'm happy to be here.
So we were chatting a little bit offline before we got started, and we're going to have some great stories, some things that people can laugh at me. It's fine. Things I've put up with in my life. But we've got 5 or 6 talking points. So we're just going to start at the top and go down our list. So first of all, we're going to talk about taking a stand for cats. And so in your small animal practice, you treat dogs and cats. Why did you decide to start the Natural Cat Vet, and what does that entail?
Well, the Natural Cat Vet is a community just for cats, and I curate content and veterinary supplies, supplements, lifestyle products that I use for my patients and my own cats. And so I wanted a place just for cats. I noticed that cats and the people that loved them just didn't get enough attention. It was kind of like, oh, we have this product for dogs, but I guess you could probably use it on your cat too. And there's so much research going towards dogs and not enough going towards cats. And I noticed that people that love their cats really wanted more. And as a veterinarian, I felt like this is my job to step up and serve the cat people. And I'm a cat person myself.
Well, there you go. And it's amazing. I think the cats, they do need their own place. And when I was, I guess when I was a senior in veterinary school, I did an externship in an emergency clinic. And one of the doctors who worked there was the cat doctor from, her practice was called the Cat Doctor in Philadelphia. And so it was pretty unusual back in the 1980s to have cat only practices, but she was one of the kind of the starting points. And it was really interesting to me that pet owners would have dogs and cats and have separate veterinarians for them. But it is so true. Now, you're a house call veterinarian, which is awesome for kitty cats because they don't have to get in a box and get in that big motor vehicle that takes them horrible places and see strangers. But for clients who were taking their cats to the veterinarian, they didn't want to sit in the waiting room next to a bunch of barking dogs. And I even saw it in my own practice. People with dogs would just, let their dog go over and stick his face right in the cat carrier opening. And it's like, why would you do that?
I know. Cats find it to be so rude. It's offensive.
It is. And cats are not small dogs. So cats are, we can't just say, well, if this is good for a dog, we'll just shrink it down and make it for a cat. And so this is going to take us into our next subject. Food requirements and nutritional requirements for cats are very different from dogs. I formulate a lot of diets, and I don't like formulating for cats. I find them to be much harder.
Yes. Cats are obligate carnivores. And when we created kibble for dogs, we thought, oh, I guess we could use this for cats too. Just another kind of cats being the afterthought. And I went to school at Texas A&M in the early 2000s. And even then we were taught that cats should not eat kibble.
You were?
Yes.
Oh my gosh. Because like I said, I went to school in the early 80s and it was all about which kibble diet to feed your cat. And it was all corn-based.
Right. And we were taught that we should mimic a mouse diet. And I have found that
I have new respect for Texas.
Totally. I think it's because it's the home of the GI lab. So there's a lot of research going on there. And so I was taught very early in my career that cats just don't do well on kibble. And
how do we convince the big pet food companies of that?
You know, that's an excellent question. I think consumers are going to convince the pet food companies. And as someone, I've worked in pet food for some time, and I see consumers driving those ingredient decks. And so
I hope so.
I want people to know that when they give pet food companies information, they're listening.
That's good.
Yeah.
We're hoping.
So keep squawking.
Really
keep squawking.
Oh, man, I squawk all the time. I'm hoping that the people that follow are also squawking.
Yes.
So what? Give me a couple of reasons why they said kibble was bad for cats. I mean, you and I both know it is, and I talk about it all the time, but let's hear it from somebody else as well.
Yes. So kibble is not ideal for cats because it has a very high carbohydrate content. And as obligate carnivores, they just can't process carbohydrates like dogs can. And even if you make it grain-free, because I have a lot of people say, but Angie, I'm feeding a grain-free kibble. It's still high in carbohydrate, maybe pea, potato, because you have to make it crunchy. There has to be.
It will not stick as a kibble. If you try to put 70% meat through an extruder, you're going to have a big old gunky mess.
Right. We were also taught by the dentist that it actually increases dental disease. So for dogs, we think maybe crunching can help. It's very minimal. But for cats, we know that crunching actually makes their dental disease worse. It causes dental disease.
Not to mention the fact that most of the time they don't crunch, they swallow whole.
Right. That is true.
Because when they puke it back up on your carpet, it's whole.
It's whole. Yes. So we were taught to mimic a mouse. High moisture, high protein, low carbohydrate.
And a little mouse hair in there for fiber. And the interesting, I was giving a lecture somewhere at a pet expo. So, a pet expo is not a scientific thing. It's a bunch of pet parents who are there getting entertainment and buying a bunch of toys and treats for their pets. And I was giving a lecture on cat health. And I said we wanted to mimic the mouse diet. And I said, I've been asking people for years to just put mice in the blender and feed it to their cat. And I was waiting for somebody to actually do that. And, said it as a joke. And a guy came up to me after the lecture and he raised snakes. And he said, well, I raise a lot of mice to feed to snakes. I might just do that. I have yet to see the mouse cat food, but I'm waiting.
I haven't seen it either.
I would think it would be cheap to produce. You can make a lot of mice really fast.
You could. Yeah, it would be cheap.
Might have to mix in a little rabbit. I mean, I don't know if anybody has done the nutritional profile on a mouse, but there must be something to it because my cats eat a lot of them.
Definitely. And I think when we change them, if we were to blend them up, would the cats like the palatability? Would they like that mouthfeel?
Do cats like any palatability? Cats are so... they're picky, but I think a lot of it is we're not feeding them appropriately. I think that's part of why they're picky.
That's right. Yes. And when we don't start as kittens and they get kibble as kittens and they don't learn to have an expanded palate, it makes it harder as they get older. They get pickier.
Yeah. When I first started my cats, I had all adult cats at the time, and I started that. I wanted to change them over to raw feeding from kibble feeding because I had learned kibble, this is what we all did. Maybe they got a little canned food once in a while, but I wanted to, once I learned better, is like, I can't do this anymore. One of my oldest cat, it took me 6 months to get her to transition over off her kibble because they get so ingrained into the texture, the smell, like the crunch. There's so much that is learned. And then the longer they're on it, the more difficult it is to change. My whole group of cats, my clouder that I have at the moment, they were started on raw, right? Their mommies were fed raw and they're all fed raw. And they love it. They've never seen a piece of kibble and I hope they never do. Yes.
And I find those raw fed kittens to be more open to other textures. So my raw fed kittens will sometimes share my dinner. They'll sample different textures on my plate and I'm for it.
Yeah, absolutely. Because I think that we can provide so much more nutritionally and, just a variety, which I feel is really, really important. So even with my raw fed cats, one meal might be a poultry product, and another meal might be a 4-legged product. Another meal might have some fish in it, and their poultry spans pheasant, quail, duck, goose, chicken, turkey. So when you can get them to enjoy that type of variety, you know that you're getting really, really good nutrition into them. So
yes, it's true.
huge.
And then if
So
something medically comes up down the road, you
Yeah.
have so many more options to hide
Exactly.
supplements, to put them on a single ingredient diet, whatever you need. You just have more feathers in the quiver when you have an expanded palate.
And I have found that when they're started off on that kind of diet, we don't see allergies and IBD and, all these GI problems. And so that kind of leads us into the next topic, which is vomiting.
Oh my gosh, I could talk about this all day. And I do. In fact, I do talk about vomiting all day.
Like, I used to think it was normal to come down the stairs and put my bare foot into a squishy pile of cat vomit because they just did that every day.
Absolutely. Well, and I was taught in veterinary school, cats vomit. And, some professors were like, oh, cats just vomit and that's what they do. And the internal medicine professors were like, no, cats should not vomit regularly. But I find that rhetoric is still out there. I have a cat trying to crawl in my light right now. That rhetoric is still out there that it's normal for cats to vomit. That's what they do. And I think it's really detrimental because usually cats are vomiting either because they're not on an appropriate diet, they do have a food sensitivity, or maybe they do have IBD and they could be getting treatment. And I think that cats walk around with stomach aches more than we know.
Well, sure. And even the whole, it's normal to puke up hairballs. I don't think it's normal to puke up hairballs. The hair should be transiting through. It should be carried through. That's where the fiber comes in their diet. And fiber is very different from starch. So when we're talking carbohydrates, maybe we have 1 or 2% in there, but that's for the fiber. So if you're feeding a prey model diet, you're going to get that feeding the whole animal, which means they're going to eat the hair and the feet and the head and the bones and all the little goodies that go along with it. We need to take a break to hear from our sponsors. When we come back, we've got some really important topics that we're going to cover, particularly for our senior kitties. So stay tuned. I'm excited to tell you about Raised Right. Raised Right is a family-owned, human-grade pet food company that works with veterinarian Dr. Karen Becker to make gently cooked whole food recipes that are high in protein and low in carbohydrates. I feel good recommending Raised Right because their adult dog recipes are complete and balanced through using only whole foods without having to add any synthetic vitamins or minerals, and most of their recipes have less than 2% carbs. That and their recipes are so simple, many having only 10 ingredients or less. My own dogs and cats absolutely love Raised Right. Order yours today by going to raisedrightpets.com/Dr. Judy. That's spelled out raisedrightpets.com/DRJUDY. Raised Right is raising the bar on high-quality, whole food nutrition for your pets.
When it comes to feeding our cats, we can all agree that it's best to feed a species-appropriate diet, right? Cats are carnivores and do not benefit from being fed a highly processed diet loaded with carbs. We'd like to offer our listeners a 20% discount off Dr. Judy's Kick the Kibble mini course. Learn the importance of feeding your cat real food, how to transition to a healthier diet, home cooking for your cat, or what to look for when shopping for high-quality commercial foods. Do your cat a favor and order today on drjudyu.com and enter code podcast38 for 20% off.
Welcome back. You're listening to Dr. Judy Morgan's Naturally Healthy Pets. I'm your host, Dr. Judy Morgan, and this is my guest, Dr. Angie Krause. She's the natural cat vet, and we are talking about the future is feline. So we've covered what we should and should not be feeding them. We've talked about vomiting not being normal. Next, we want to talk about urinary issues. And I was telling Dr. Angie before we went live that I have had more cats with pee-pee problems in my life. Like, I can't believe that my husband and the rest of my family has put up with the cat issues. And I actually had one cat who once peed in our toaster, and we didn't realize till we were cooking a bagel in the morning, and it did not smell like a bagel. There was no cleaning that toaster. It just went out in the trash. And as Dr. Angie said, how could that even be comfortable to be squatting on a toaster? I just don't know. And with an entire household of things to choose from, why? So in the notes, you say urinary issues are less likely to be medical problems. Let's talk about that.
It's true. A lot of people bring their kitties to the vet saying my kitty's, urinating outside of the box, peeing on my bed, peeing on the wall. And rarely is it a medical problem. And unfortunately, most veterinarians aren't really equipped to talk about cats' mental and emotional health and what could be going on around them to stress them out or make them feel uncomfortable. And so I think it's really important for people to understand, just like when we go see our physician, they might not be the best person to talk to us about our mental and emotional health, that there are more resources out there for kitties.
So do we have kitty psychiatrists? Do we have a little kitty couch that we're going to put them on?
Absolutely. Yes. People like Jackson Galaxy, they are teaching us so much about how we should be keeping our homes. Cats need vertical spaces. Cats need to escape. Cats fight with each other. Often I see as a house call vet, I get to go into people's homes and see what's stressing this cat out. And I will tell you so often there is a cat outside causing complete havoc, never comes in the house, but it's the neighbor's cat that lurks in the backyard and disrupts the whole ecosystem. So, antibiotics and doing all these things probably isn't going to help. The Prozac might not help. And, all these things that Western medicine can do, which is honestly not a lot. Unless your cat has stones or crystals and is blocked most of the time, it's not going to be a medical issue.
Yeah, bacterial infections in cat urine are actually very rare, but the treatment has always, that's what I learned in school. Hey, your cat's peeing outside the box, the cat's got cystitis, they go on antibiotics. When I started studying Chinese medicine, it was like, oh, now I know why the antibiotics work. They're cooling. Right. So it's energetically cooling. They're cooling the inflammation. They're not killing bacteria, except for in the gut where we kind of don't want to kill the bacteria. So if your cat is having urinary problems, yes, go get them checked out. Make sure they don't have stones. They don't have a lot of crystals. Make sure you're feeding them a species appropriate diet that has a lot of moisture in it. And go ahead and get a urine culture. Don't just put them on antibiotics because there's a really, really good chance that they don't need them.
Right. Unless they're 15 with kidney disease, chances are it's not bacterial.
Yeah. So most of the time it actually is behavioral.
Yes.
And like you said, it could be the cat outside. In my house, it's been inner cat problems. Like I had a brother and sister. I didn't realize the brother was intimidating her, but he was. She was 5 pounds. He was 15. Yeah. So, and he seemed like a big mush, but once he passed away, she's like, oh, now I can come in this room and now I can get near the litter box and life is pretty good. Of course, then I got a dog that likes to chase the cats. So the cat is back to living on the piano and the windowsill because she needs her vertical space to get away.
Right. Exactly. It's important to think about those vertical spaces. And the other thing that I'll say that might be controversial is it's okay to rehome kitties if there's a lot of problems between cats. And a lot of people don't like to hear that. But I know when I was living with someone I didn't want to live with, and then I got to move out, my life got a lot better. And I think that's true. that is an option that is really shamed. Now, I'm not saying go dump your cat at the shelter, but it's okay to look for other options. And people really feel like they've failed their pet if they've done that. But I don't think so. Sometimes it is the most loving thing you can do for everybody involved.
Well, that is true, because I feel sorry for my poor little kitty who spends most of her time on top of the piano and the windowsill because this dog, if she's down on the, luckily he's pretty much blind. So if he smells her, he's trying to find her, and she knows that she can get away faster than he can find her. but still it's very stressful for her. So I find that at night when he's in the bedroom, she's wandering all over the house and, doing her exploring and things that she likes to do. And if I get up in the middle of the night, she's begging me for snacks. So we kind of have this nighttime relationship now.
Yes.
But I actually had and this I think is pretty important and people may not think about it. I had a communicator in my office one time and we were dealing with a cat with urinary issues, and he was communicating with the cat and he said, well, your cat just told me that the other cat in the house beats her up all the time. And the owner said, that's true. And he said, I also see that your litter box is tucked way back in a corner in your room that you use as an office, and the litter box is way back kind of around in a corner. And the owner said, yeah, it's to keep it and the kitty litter out of the way. And he said, well, your cat is scared to death to go there because she keeps getting cornered by the other cat. And so she needs that litter box where she has a 360 view and she can see if he's around. And, as long as the other cat isn't around and she's not going to get cornered, then she'll use the box. Yeah. And so the box got moved and the cat was absolutely fine. So if you can find a communicator, they can make it a lot easier for you. But I will say that a lot of times cats do not like to be cornered. So solving the issue with my little kitty who's been peeing and her brother was being mean, unbeknownst to me, we gave her a covered box with a clear cover so she could see out. Oh, nice. And we put it up on a counter. So she also had that elevation. So she didn't have to worry about it. My dogs are small. She didn't have to worry about a dog getting near her in the box, and she could see exactly what's going on. And so she's using the box beautifully. Yeah, it's a little bit of a weird setup, but it's working great. It's in my laundry room. So
great.
Yeah, it's working great. So, and the other thing is changing up your kitty litter. Sometimes they just don't like the substrate.
Definitely. And there's so many products on the market. You can find something that your kitty will.
I had one of my technicians one time, she had a dozen cats, and one cat would only pee on plastic bags. So if she had brought home groceries, that cat was peeing on that bag. And I said, why don't you shred up some plastic grocery bags in a litter box? And that's what the cat wanted to use.
Yes. My last cat would only poop on smooth plastic. So I had a litter box without litter for him to poop. There you
go. Oh man, we're going to run out of time. So I want to talk about senior cats real quickly. And there are two things that we know that cats suffer from silently. There's probably many, but two that I want you to touch on real quickly are hypertension and arthritis.
Yes.
What should we be looking for?
So cats, if your cat has been diagnosed with kidney disease, even early stage kidney disease, I want you to have your cat's blood pressure monitored every 6 months. Hypertension comes on slowly. It often doesn't have a lot of symptoms. Sometimes they can have a little bit more dilated eyes. But unfortunately, the first symptom we often see is sudden blindness. And it's completely preventable and it's easily treatable. And so if your veterinarian says your cat has kidney disease, I want you to ask for a blood pressure to be monitored. My preference is using a Doppler, and I have all the privilege in the world because I get to do it in the comfort of kitties' homes. So if you can find that, that's even better. But I want you to be paying attention to that. And the second thing.
Yeah. And the thing is, even if they're stressed at the veterinary office, if you get a baseline, you should get a baseline before they have kidney disease, find out what your cat's blood pressure is at the veterinary office. Because if it's normally running 175, and now all of a sudden it's 250, that's different. Right. It's a problem.
Right. Yep. That's enough to cause sudden blindness. Because what happens is the retina is detached from the back of the eye. And, it's hard on kitties when that happens. They can definitely live blind, but if they didn't have to, let's prevent it.
It would be better. Yep. All right. So let's talk arthritis.
Arthritis. Most senior kitties have some form of arthritis. And unfortunately, people have this concept that cats should sleep 22 hours a day and they become less mobile and people don't notice. They're like, oh, they're older. And fortunately, we have so many modalities to treat arthritis, and cats don't have to suffer. So if you notice that your cat is not jumping on the bed or doesn't walk down the stairs, a lot of people will say, oh, I'll just bring everything to my cat. But what I want you to do is to treat their pain, whether it's acupuncture, herbs, chiropractic, massage. We have a lot of things out there. And then I want you to keep them moving. I want you to keep them moving around your house.
Well, I think that we don't keep our cats moving enough in general because we're like, oh, they're just doing their cat thing. And so we don't interact with them as much unless if you are a cat, like if you have dogs and I have a million animals. So it's a little like, oh, geez, take time to play with everybody. So if you are, only a cat owner and you're really interactive with your cats, they're probably going to get more interaction and playtime with you. But a lot of cats, the owners are gone all day. That's why a lot of people have cats, because it's like, oh, well, they're happy while I'm at work all day. But you do need to interact with them, and you do need to make sure that they're moving however you want to do that with them. So get some interactive toys, things that you can play with. And the most common symptom for arthritis in cats is none.
I know.
So it's very sad, but take notice. Did they used to jump on and off the refrigerator and now they only will jump 2 feet, or to get up on the table, they have to take multiple, like I'm going to get to the short chair, then I'm going to get to the taller chair, then I'm going to get to the table, then I'm going to get to the counter. Are they having to do it in multiple hops? Are they sitting and thinking about it before they go? So there's so many things. I'm going to have you come back again because we didn't even get to touch on thyroid and kidney issues in cats a little bit, but those are so important, particularly in our cats as they're aging. And I'd also like to talk more about dental health with kitties. So we are going to have you come back again. Dr. Angie Krause, thank you so much for the work that you're doing. And it is so nice to have someone who is really paying attention to our kitties. We are getting more people who are really focusing on the cats. And I think the cat community is very happy about that.
Yes, they deserve it. They deserve everything. Yes.
They do. I love my clouder. So you can find out more about Dr. Angie Krause and her natural cat vet community at naturalcatvet.com. Very simple.
Yes.
Until next time, thanks for listening.
See you later.
Thanks for listening to another great Naturally Healthy Pets episode. Be sure to check out the show notes for some helpful links. And if you enjoy the show, please be sure to follow and listen for free on your favorite podcast app. We value your feedback and would love to hear from you on how we're doing. Visit drjudymorgan.com for healthy product recommendations, comprehensive courses, upcoming events, and other fantastic resources. Until next time, keep giving your pet the vibrant life they deserve.
The purpose of this podcast is to educate and to inform. It is no substitute for professional care by a veterinarian, licensed nutritionist, or other qualified professional. You're encouraged to do your own research and should not rely on this information as professional medical advice, diagnosis, or treatment. Dr. Judy and her guests express their own views, experience, and conclusions. Dr. Judy Morgan's Naturally Healthy Pets neither endorses or opposes any particular view discussed here.